Hi Daisy, how may I help you?
Well, my daughter Daphne has just been driving me up the walls lately. She just cannot sit still, and every time it's time for dinner, she's just banging on her plates, playing with her food. She's always making a ruckus, and I feel like I cannot get a moment of peace and quiet.
Okay.
It's to the point where I just want to cover my ears with my pillow and drown out the sounds, because she's always making noise and moving non-stop.
I see. How old is Daphne?
She's 6 years old.
Well, from a professional standpoint, it sounds like she has attention deficit hyperactivity disorder, also known as ADHD.
Yes, that's exactly what I've been trying to tell everyone. You are so smart.
Well, I'm glad I got that figured out for you. Now let's see what we can do to help you, and Daphne, of course. Sounds like she needs to be on some Ritalin to get her behaviors under control.
If that'll make the screaming stop, then sure. Ritalin sounds good.
I guess 2 important things before I get my notepad out. First thing, is Daphne with you today? It could be helpful to meet her so I can evaluate and perform an assessment.
Well, she's actually at home with my husband right now, but trust me, she is a terror. She has a really short attention span. She's hyper and all that, and she doesn't listen to anything that I say, and she's just moving all the time and all of that.
Sounds rough.
Yeah.
Well, I don't normally do this, but you know what we could do? We could start her with a trial prescription, maybe like a week or so you can bring her in, and then we could do a formal assessment.
Yes, that would be perfect. Thank you so much, Doc. You are so amazing.
Second thing is she on any other medication?
Well, my husband gives her some medication every day, but I honestly can't remember the name right now. Sorry, it's so hard pronouncing all the names, but it has something to do with her mood or something. I don't know. Sorry about that.
No, it's okay. Knowing all the names of medication can get pretty tough. Sometimes different drugs can have an interaction with each other, so if you see any bad side effects, just let me know.
Sounds good. And, well, another thing is that, Daphne has a little brother. He's 4, and he's kind of a terror, too. I mean, I know that technically he's not diagnosed with ADHD yet, but do you think it would be okay to give him some of Daphne's Ritalin, too?
Well, technically this prescription is for Daphne, so I'm not too sure.
Well, I mean, I guess that makes sense.
I mean, if you feel like she's displaying the same behavior as Daphne, you might as well just kill 2 birds with 1 stone instead of having to get another prescription.
Thank you so much again, Dr. Chirp. I really appreciate it. I knew that finding a doctor that I could just pay out of pocket for would be the best solution.